A very good afternoon and welcome to the Public Health Thought Leadership Dialogue presented by the Swee Hock School of Public Health. Today's topic for discussion is challenges to current and future tobacco control. We're very delighted to have with us today guest speaker Prof Kenneth Warner, as well as a esteemed panel of public health experts to closely examine the challenges to tobacco control strategies and measures. I would now like to invite Dean of Swee Hock School of Public Health, Prof Heng, to deliver his welcome address and introduce our distinguished speaker for today's session. Prof Teo, please.
Professor Kenneth Warner, distinguished guests, ladies and gentlemen. And actually, before coming up to the stage, I was just sharing with Ken that I'm still not used to people addressing me by the full name. Everyone just calls me YY. Good afternoon, and a very warm welcome to the 8th Public Health Thought Leadership Dialogue hosted by the Swee Hock School of Public Health at the National University of Singapore. The Public Health Thought Leadership Dialogue series is our signature public health forum that is focused on relevant and timely issues that have considerable health impact to populations both locally and in Singapore and across the globe. Organized under the Leadership Institute for Global Health Transformation, or affectionately termed as LIGHT in-house, this forum provides a platform for candid, meaningful discussion with public health experts to explore the latest evidence and to identify real solutions to advance the health of populations. Previous dialogue series have actually focused on issues such as the promise of personalized medicine, health promotion at the workplace, the silent but increasing burden of NCDs, and in the most recent dialogue, local and global action against antimicrobial resistance. Today, we have a panel of passionate public health experts whom cumulatively have spent decades in studying what is the single most important cause of preventable deaths worldwide and to drive national and international policies against this. That's tobacco. Tobacco has evolved from an endorsement by doctors as a health-enhancing product in the 1930s and 40s to one where I quote the first study published in the British Medical Journal by Sir Richard Doll in 1950, the risk of developing peptic ulcers increases in proportion to the amount smoked. It may be 50 times as great among those who smoke 25 or more cigarettes a day as among non-smokers. Clearly, the evidence that we have now in 2019 on the devastating health impacts of tobacco use overwhelmingly surpassed the insights that we have in 1950 for peptic ulcers. Right now, tobacco use is linked to considerable increases in risk to a whole range of cancers, miscarriages, complications to NCDs such as diabetes and hypertension, bronchitis, infertility, erectile dysfunction, premature aging, and the list goes on. Yet, despite the clear linkages between tobacco use and poor health, smoking prevalence in most countries have not fallen dramatically. Why is it that people continue to engage in an act that at the conscious level they know will ultimately harm and kill them? Globally, big tobacco knows the cards are increasingly stacked against them. Policy recommendations by the WHO and government actions to denormalize and to disincentivize smoking are posing real threats to the future of big tobacco. In response, tobacco companies have evolved, innovated, as well as embarked on seductive but dangerous masquerades of smoke-free world where alternative products are being marketed under the guise of harm reduction, where the same products are effectively traps to snare youth into starting the tobacco habit. Why I use the adjective dangerous to describe this approach is that the concept of harm reduction in itself is laudable and actually worthy of serious policy consideration to help current smokers who are unable to quit. However, alternative products that achieve harm reduction for the smokers should also never open the floodgates to enable young smokers to start smoking. That's my view. This is why today's dialogue session specifically aims to look at the way tobacco control measures remain relevant in a world with tobacco product innovations and with social media influencers. It is thus fitting that our distinguished speaker today, Professor Kenneth Warner, is an internationally renowned tobacco control expert. Professor Warner is Dean Emeritus at the University of Michigan School of Public Health, and is also the Avedis Donabedian Distinguished University Professor Emeritus of Public Health. Ken, on behalf of everyone here, your steadfast and lifelong campaign in combating the public health threats posed by tobacco has been inspiring. And I certainly look forward to your plenary session as you walk us through your thoughts on the current and future directions in tobacco control. Ladies and gentlemen, please join me in welcoming Professor Ken Warner to the stage. Ken, please.
So I've been asked to address challenges to current and future tobacco control, and to do so, I'm going to cover what you see on the screen before you. If we want to think about current and future challenges, we have to start out by asking, where are we? So I'm going to look briefly at the current status of smoking in a global context. I then will examine trends in smoking among adults, both trends to the present and trends moving forward as they are projected to occur. I'm going to focus just on smoking, in part because the data are so much stronger on it, but really because smoking is by far the most important form of tobacco use. There are only a couple of countries where that is not necessarily true. Smoking is responsible for the vast majority of tobacco-related mortality, and I will focus on that. I'm going to focus on adults because, frankly, the data on kids at a global level are not very good either. So after examining trends, I'm going to turn to the role of the Framework Convention on Tobacco Control. I suspect that most of you are familiar with this international treaty. It is not perfect, but it is working to reduce smoking worldwide. And I'm then going to briefly consider obstacles to further progress in tobacco control. And I'll follow that discussion with an overview of two of the hot issues in tobacco control. One of them is the notion of a tobacco endgame, and the other that YY just mentioned is the idea of tobacco harm reduction. So I want to start out with looking just at the current status of global tobacco use. Here are estimates from the World Health Organization. They say there are a little more than 1.1 billion smokers worldwide. The vast majority of them, 939 million, are men, and we're talking about people 15 and older here. About a third, a little bit more than a third of all men are smokers, whereas for women, you're looking at 175 million, or about 6.4%. So overall, about a fifth of all people in the world, all adults, are smokers. But it's a huge difference between men and women. If we look at the regional data by WHO region, we see a wild variation. You can see that here in the last column, from 10% in the African region to almost 30% in the European region. You can also see big differences between males and females in all regions. But I think it's important to look at the differences in a couple of these regions. If you look specifically in Europe and the Americas, the difference between men and women is less than twice the rate for the women. If you look at the other regions, the difference is enormous. So for example, if we look in the Eastern Mediterranean, Southeast Asian, and Western Pacific, we're looking at rates of smoking that are about 15 times higher for men than they are for women. Now, an obvious question is, why do we care about these numbers at all? And I think there's one number I can give you that will answer that question very easily. 7 million. That's how many people are killed by smoking worldwide every year. And to put that number into perspective, smoking is responsible for 1 out of 8 deaths around the world. In some countries like my own, it's about 1 out of 5. But it is an enormous influence on health, and as we'll see later on, a lot of people aren't paying too much attention to it today. Keep in mind as well that for every person who dies as a result of smoking, there are 30 people who are sick or disabled by smoking. They're living with the consequences of smoking. So we're looking at more than 200 million people who are ill. So where are we headed in the near future? And to do that, I'm going to look at both recent and projected trends in cigarette smoking. And if we take a look, you can see here in the top Three columns here, or four. This is where smoking has been, and then these are projections for WHO in 2020 and 2025. And it's done by region. And the good news is that smoking is trending down worldwide. And the projected trends are the same for that. It's down in all regions, but it's slowly declining in Africa, and especially Eastern Mediterranean. We're quite worried. Why? I'm not showing the data on gender in this particular table, but if you take a look here, you'll find that women are trending downward and are projected to trend further downward throughout 2025. And men, that's generally true, but in Africa it looks like prevalence is sort of leveling off, and in the Eastern Mediterranean it's projected to rise. So that's a serious problem. One more number to take a look at here. That's the number of smokers in 2015 and the projected number of smokers in 2025. And if you look in this column that says actual, I assume, yeah, you can see the cursor there. If you look at the column that says actual, what we're seeing is that the number of males over that 10-year period is going to increase by about 1%, while the number of females is going to decrease by 16%. But keep in mind, we're not adjusting for change in the population here. And as you're well aware, there's an important aging phenomenon going on. It's occurring worldwide. If we account for that, we adjust for population growth, what we're looking at is a 10% decrease in this 10-year period for males, and for females, a 25% decrease. And I think that population adjustment is very important because the adult population is growing so rapidly around the world. Now, if you take a look at the totals here, you'll see that we're looking at numbers that really aren't changing very much. It's staying at about 1.1 billion. But, as I noted, you adjust for population growth, you might say it's okay. We're doing a little bit better. Now here's the last graph I'm going to show you on cigarette consumption. I think this is enormously important. If you take a look at this, for 130 years, the total number of cigarettes was rising quite rapidly. And then, in 2009, it peaked at 5.9 trillion cigarettes. And it has been dropping since then. The latest year here is 2017. What does that tell us? It tells us that cigarette smoking in the aggregate has fallen by 8%. But again, population's growing. So what we've observed in essentially an 8-year period is a decrease in total cigarette consumption on a per capita basis of nearly 17%. That is very impressive. By the way, I don't know about you, I have trouble with numbers like 5 trillion or 6 trillion. Let me put some perspective on that for you. That's equal to 2 cigarettes for every man, woman, child, and baby in the world every day. That's what that number means. In any event, I find these numbers overall to be fairly encouraging. But if we sort of look at the story, where are we today? It's a mixed story. The tobacco control cup is half full. Why? Because we've made important strides forward, and we do seem to have reached the peak of the epidemic. That seems to have reversed. And again, I think this graph is perhaps the most telling of all in that regard. But the cup is half empty too. I mentioned 7 million people dying. That's about an eighth of all deaths in the world. That's an extraordinary number. And in addition, despite everything we know and everything we do, almost a third of men are smoking pretty much on a daily basis today. So from here, I want to turn to the role of the Framework Convention on Tobacco Control. I'm just curious, by the way, how many of you are not familiar with the Framework Convention on Tobacco Control? I'm sure there are some. Okay, how many of you are not familiar with it but won't admit it? The fact is, if I asked that question in the United States, almost every hand would go up, even in a public health audience. And it's interesting, Framework Convention on Tobacco Control is the world's first global health treaty. It is one of the most rapidly and widely adopted treaties in the world. There are only 16 countries in the world, actually I think it's down to 13 now, that have not ratified the treaty. Unfortunately, I come from one of those countries. Now, the FCTC is largely an evidence-based treaty, and it was a quite remarkable experience. I actually had a small role in it. It was a very exciting one. I was the World Bank's representative to 4 of the 6 negotiating sessions in the early 2000s. I don't know if you can see me right here, but that's where I am. Up in the nosebleed section, as we refer to it at home. This was a quite remarkable experience in both the best senses of the word and in the worst senses of the word. I won't have time to talk about that now, but I can come back to it later if there are questions about it. So it's an evidence-based treaty, and a lot of the evidence came from this report, Curbing the Epidemic, Governments and the Economics of Tobacco Control, that was produced by the World Bank. It was referred to often. I would say that the major demand reduction measures in the treaty come from the evidence that was supported by this book. This book really became a Bible of the hearings. And so these really are the 5 most important demand reduction measures according to our evidence base. There's a 6th measure called Surveillance of Tobacco Use and Implementation of Tobacco Control Policies that with these 5 make up something that the tobacco control aficionados in the audience will know as Empower. Those are the 6 steps that WHO says we have to engage in. WHO tells us there are 121 countries that have implemented 1 or more of the complete Empower measures. But the implementation remains limited, and it's very uneven across countries. Now, there's some very interesting recent research by Gravely and her colleagues in which they looked at the adoption of the 5 most important demand reduction measures in 126 countries. And they looked at them when they were implemented at the highest level. So this is what WHO actually called for. And they found that each additional measure among these 5 would decrease cigarette smoking by 1 percentage point if it was fully implemented. Now you may say, what's 1 percentage point? 1 percentage point is a lot. There are about 20% of the public that smoke, so that's a decrease of 5% in smoking by a full implementation of one of these 6 measures. Actually, one of these 5 measures, the power in Empower. So that's the good news, but there was a lot of bad news in this study as well. As of the study's end date, 2014, not a single one of the 5 measures had been adopted by more than 28% of the countries. There were only 5 countries that had fully implemented at the highest level, 2 out of these 5 measures. Half of the countries did not fully implement any of the demand reduction measures. Now I want to emphasize, this was the status at the time of this study in 2014, and it was looking at the highest level. If we look at the data subsequently, things look a little better. So we're looking at data here for 2016 in the pale color, and then 2018 for the brighter red that is much easier to see here. And things look pretty good. You've got large numbers of the countries reporting that they are working on these various measures. But they aren't implementing them at the fullest level. So let me illustrate. Here I've put in red price and tax, and you'll see that nearly 2/3 of the country say that they have been making progress on price and tax. But full implementation, according to WHO, involves setting tax at least 75% of retail price for the most common brands of cigarettes. There are very few countries anywhere in the world that have achieved that. So what can we conclude today about the FCTC? Well, first of all, I think we can say there have been some real successes from it. It has motivated adoption of tobacco control measures in many countries. I've been particularly impressed by many of the African nations, actually, and what they have done. The policies do reduce smoking. We know that. But the implementation of the SCTC's required measures is painfully slow and frustratingly incomplete. To reduce the still very high levels of smoking requires fully implementing these Empower policies. But that in turn requires effectively addressing a series of obstacles to progress. And I want to turn to them now. So what are the obstacles or challenges that we have to deal with? First and foremost is a lack of political interest and will. This is a function, in part, that governments do not perceive tobacco control to be a priority issue. Think about the importance of it in public health and the fact that governments are not interested in it. But it's also true that the public are not interested in it. To the public, tobacco control is yesterday's issue. It's something we used to worry about. And many people, particularly among those who are politically engaged, think that smoking has been solved because they don't smoke, their friends don't smoke, they don't see it in their workplaces, and they just don't think it's an issue. And yet we have these huge remaining pockets of smoking that are having enormous impacts on health. So second, there's a lack of adequate leadership in many countries, not all, but in many. And in part, that's due to the third thing here, a lack of adequate resources. We can't fund the leadership that we need. We also don't have enough money to support research. We don't have funds to support communication with the public or to develop and lobby for needed legislation. This is something that I suspect my colleagues from the region here will have something to say about. Last, but decidedly not least, is industry interference. So what do? Well, first of all, the industry tries to influence government leaders and legislators, and frankly, they're very good at it. Part of it's through direct gifts, money. Part of it's through lobbying. Some of it's much more subtle. In my own country, you would be shocked at how many high-level government appointees are attorneys from the companies, the law firms that were representing the tobacco industry. And it happens year after year after year, administration after administration. So they have some subtle influences. And then there's the industry's trumpeting of its own economic importance. They have an argument that basically says, now smoking isn't good for you, but if you adopt anti-smoking legislation, you're going to reduce sales of cigarettes, and that means in turn that you're going to reduce jobs in farming, in manufacturing, in wholesaling, and in retailing. You're going to lose those jobs because people aren't buying cigarettes anymore. They actually do macroeconomic analyses where they estimate the precise numbers for the relevant jurisdiction, whether it's a city or a country. And they parade those in front of the legislators. I've seen this personally in the US many, many times. Now, the loss of tobacco business can hurt a couple of countries. Not many. There are two in particular where it's enormously important because they're very big on tobacco farming exports. That's Malawi and Zimbabwe. For the rest of the countries, frankly, this argument simply does not hold. It is not true. Why isn't it true? Because the money people are not spending on cigarettes doesn't simply, if you'll pardon the expression, go up in smoke. It doesn't just disappear. People spend it on other goods and services, and that alternative spending produces a comparable number of jobs in other industries. This is something that, if there are economists in the audience, they'll appreciate this. Economies are built to support a given number of jobs. It doesn't matter really what they're doing, what people are doing. I mean, it matters a little bit, but basically, you're going to end up with the same numbers of jobs in the economy as a whole if the money is spent on other goods and services. If your economy is not dependent on tobacco, doesn't have a lot of tobacco farming, you're actually going to gain jobs because people are going to spend the money on more indigenously produced goods and services, and you won't be exporting the money to the tobacco states or nations. Okay, we did 2 studies in the mid-90s where we did macroeconomic analysis and demonstrated what I've just described to you for the United States. Subsequent to that, there have been some 15 other countries that have done studies like this, and they all find exactly the same thing. Now, I'll return to the industry interference. They manipulate public opinion. I don't know whether they do this here, but we have a lot of public interest ads, as they refer to them, from the industry. They use front groups. Again, in the United States, I don't know whether this was true here, but when we're trying to get a law passed to ban smoking in the workplace, including restaurants and bars, at the state level, the industry puts lots of money into restaurant associations so that they will lobby against the law. They do that every time. They try to discredit science. They've been doing that since the beginning of time. When the first research came out implicating smoking and lung cancer, they denied that smoking caused lung cancer. Their own internal research had proved it to them. They knew it from their own research. And they threaten litigation against governments. In this region of the world, Australia is the first country to have adopted plain packaging. They faced an enormous industry lawsuit, and it took them millions of dollars and many years of work on the part of government officials and tobacco control activists to beat the industry in court. And fortunately, they were successful in doing so. Further, faster progress on tobacco control at the global level is going to depend on dealing with these obstacles effectively. Now, progress may be affected by two new developments. One is the attempt of tobacco control activists to get their governments to adopt novel policies that will end the use of tobacco in the foreseeable future. This is called the tobacco endgame. Over the past decade, there are a few countries that have made the commitment to end tobacco use within a period of 10 or 20 years. They're generally defining tobacco use or smoking. Some of them refer to smoking rather than tobacco use. They're generally defining this as within about a prevalence of 5%. If you get smoking down to prevalence of 5%, they will consider that successful. I want to emphasize that these governmental commitments rarely come with any kind of budgetary plan or resources, and that's obviously a problem. There are four types of proposals, and I'm doing this very hastily. I'm not going to be able to go into these in any detail. I'm going to give you one example from each of these categories. So regulation of tobacco products. The most interesting example at present comes from my country, where the Food and Drug Administration is seriously considering the possibility of requiring the reduction of nicotine in cigarettes and other combustible products to levels not capable of sustaining addiction. It's not hard to do. We actually have, it's the same process you do for decaffeinated coffee. It's an easy thing to do. That is being considered by our Food and Drug Administration. User restrictions. Here, the single most prominent example of this comes from Singapore. And this is the idea of a smoke-free generation. Doctors Khoon and Berwick and some others introduced the idea many years ago now. And the idea is that you would prohibit sales to anyone born after a given year, say 2010. And that those people would know from the time they were little that they would never legally be able to buy tobacco products. The government of Tasmania in Australia has taken this under serious consideration to adopt it there. So none of these approaches, there's also the institutional approaches. Basic idea here is having some form of governmental control of the distribution, sales, sometimes manufacture of tobacco. None of these approaches has been tested, and if you think about them, each one of them comes with some pretty serious problems associated with it. But they have encouraged creative and enthusiastic thinking about new ways to tackle the remaining toll of smoking. I'm now going to turn to the issue of harm reduction, which YY mentioned at the beginning. And this is a vigorous debate all over the world right now. It's a debate over whether reduced risk products, which are also known as alternative nicotine delivery systems, are a good thing or a bad thing for public health. Here is a graph that shows you virtually every kind of reduced risk product. I'm going to focus on the case of e-cigarettes initially because that's kind of the poster child of reduced harm products. In the U.S., the e-cigarette debate is without a question the most contentious, the most divisive that I have observed in my more than 40 years of working in the field of tobacco control. There are two basic sides to the debate, or maybe you could call it an argument. The mainstream public health community, consisting of governmental public health agencies and NGOs, believes that e-cigarettes risk causing a new epidemic of nicotine addiction among young people. They believe a subset of them will go on to become cigarette smokers. They think that e-cigarettes themselves pose a significant health risk, and they believe that e-cigarettes are not helping significant numbers of adults to quit smoking. That's one side of the argument. On the other side, you have the harm reduction community, which consists of many leading researchers, public health advocates who support free choice for adults, and of course the community of vapers. They believe that vaping and reduced risk products more generally are substantially lower risk than cigarette smoking, are helping large numbers of cigarette smokers to quit, and are not turning otherwise never smoking young people into cigarette smokers. Overall, the evidence of the public health implications of vaping is mixed. It is a vastly, rapidly growing body of literature now. My own research suggests that the likely benefit to adult smokers in terms of helping them to quit substantially outweighs the greater risks to young people for starting nicotine use. But I remain open to evidence that could change my mind on that. I regret I'm not going to have time to go into a fuller discussion on harm reduction as embedded in the e-cigarette today. That's a full lecture in and of itself. In fact, it's probably 2 or 3 full lectures. What I am going to do is discuss the one major natural experiment in tobacco harm reduction to date. Why I mention that the idea of harm reduction is actually one that we revere in public health. We do it in all kinds of areas. So in some ways, it's ironic that we haven't been very accepting of it in the area of tobacco control. But let me give you this one example, and that's the use of snus by men in Sweden. Now, snus is a low nitrosamine smokeless tobacco, which has been used by large numbers of Swedish males instead of cigarettes for 4 or more decades. So this has been around for a long time. Swedish Match, the major producer of this set of products, stopped making cigarettes decades ago and decided to focus on this. There was a big price difference, and people men switched over to the smokeless tobacco. There have been few, if any, significant health hazards associated with the use of snus, and it has been studied to death by the Swedish Health Ministry and many others. If you include both smoking, cigarettes, and snus, adult male Swedes have a pretty average daily tobacco use rate compared to their European Union male colleagues, other countries in the European Union. But they have the lowest smoking rate of all of the European Union countries for men. And it may be the lowest male smoking rate of any country in the world. What's the consequence of that? I want you to think about this. Swedish men have the lowest tobacco-related death rates of all European countries by far. In most instances, if you look at this graph, their rates are way below the second lowest country in the European Union. Now, importantly, few Swedish women use snus. And until recently, they had pretty typical smoking rates of women in Europe. And what do we observe? As you see here, their tobacco-related death rates were actually above average for the European Union. So it appears that snus has been a very successful natural experiment in harm reduction for men in Sweden. And by the way, you'll find Swedish health authorities who will debate that one too, but I've gone over this data in great detail. I just don't see how you can interpret it any other way. Now, whether e-cigarettes and other novel products, one of them that you may be aware of is Eijk by Philip Morris International. Japan Tobacco has produced one and a few others. These are called heat not burn or heated tobacco products. What we are seeing is that products like this, e-cigarettes and these heated tobacco products, are having a very big impact in reducing smoking in Japan and South Korea. There's also a reduction due primarily to e-cigarettes in the US and UK. I just saw some data today that said over the last 4 weeks, there had been a reduction in cigarette sales in the United States of 8%. Our normal reduction is on the order of about 2.5% to 3%. And we've been seeing data like this for year after year now for quite a bit. But we're still going to have to stay tuned to understand the ultimate effects of e-cigarettes. So I'm going to conclude by noting that a review of where we are in tobacco control and where we're going in the near future kind of leaves us with the classic good news, bad news story. And I'm going to illustrate by considering the situation in my own country. We definitely have our share of bad news. Despite all of the evidence and all of the policies in the United States, 1 out of 7 adults continues to smoke. That's pretty discouraging. Smoking is killing nearly 500,000 Americans a year. That's between a sixth and a fifth of all U.S. deaths. But I want you to consider the good news. This is a complicated graph. All you need to do is look at the direction. This is adult per capita cigarette consumption. It turned around. It was going up very fast. It turned around the year of the first Surgeon General's report in 1964, and it has been plummeting ever since. Smoking prevalence, which was once 43% in the U.S., is now down under 14%. Tobacco control in all of its forms has been responsible for avoiding 10 million premature deaths in the United States. I'm over 70 years of age, but I fully expect to live to see a large number of countries drop below 10% prevalence of smoking. And in the case of my own country, I expect to see that in the relatively near future, and we won't be the only ones. Now, Singapore is another country that has achieved a great deal in the area of tobacco control. I know that you are concerned that it appears much of your success has leveled off recently, and that is a legitimate concern. But your smoking rate is quite low, and if you look at the implications from a health point of view, you're doing quite well. So here we're looking at smoking attributable disability-adjusted life years per 100,000 population. Singapore is shown here in red. In the area, only Brunei is close to Singapore. And in fact, if you look at the other ASEAN and OECD countries on average, Singapore is doing dramatically better. By the way, this graph comes from an excellent review of Singapore's tobacco control situation that was written by 2 people who I believe are affiliated with School of Public Health. They may be here. Come up and say hi if you are. I'm very impressed with the article. When you consider the situation in countries like the U.S. and Singapore, I think you can appreciate why I'm optimistic about the future of tobacco control. We simply have to keep fighting the good fight. Thank you.
Thank you, Prof Warner, for sharing your insights on this very timely topic. Next up is the panel discussion and question and answer session. May I invite Prof Warner to take a seat on stage together with our panelists, Dr. Derrick Heng, Group Director of Public Health, Ministry of Health, Singapore, Mr. Beng Khoon, Director, Preventive Health Programs Division, Health Promotion Board, Singapore, Dr. Yvette van der Eijk, Senior Research Fellow, NUS Swee Hock School of Public Health, and last but not least, our session's moderator, Prof. Chia, Founding Dean, NUS Swee Hock School of Public Health. As mentioned earlier, we will be using Pigeonhole Live for you to submit your questions. If you have a smartphone, tablet, or laptop with you, simply launch your internet browser, go to www.pigeonhole.at, key in our event passcode, which is SSHSPH. I repeat, it's SSHSPH, and click Go. You will then be able to submit your questions, and you can also vote for questions asked by other members of the audience. We will try our best to address all of them, but should we run out of time, our panelists will address the questions with more votes. Our ushers, wearing orange lanyards, will be on standby, so if you need help or you're unable to access Pigeon Hall, please raise your hand and wave them over. I will now hand it over to Prof. Chia to start the panel discussion. Prof. Chia, please.
Okay, thank you, Linda. Perhaps just to put before the dialogue starts, just to put things in the local context, I'll just show you one slide to describe the tobacco control within Singapore context. So firstly, this is the prevalence of smoking among male Singaporeans. And I just deliberately wanted to show it in males because females are very obedient. The females' smoking prevalence is pretty low. In males, it hovers between 20 to 25%. We don't have data, say, in the 1950s, 1960s, but it is not inconceivable to think that actually in the past, more than 50% of our males were smokers. In other words, those of you who are 60 years old today, Merdeka generation, right? Yeah. We were born into an environment where every other male was smoking, right? So we were in those kind of environment where smoking was perhaps pretty normal. But because of the decrease in the prevalence of smoking over time, our lung cancer incidence in males, that was the most direct impact, actually have been coming down pretty dramatically. And although it's essentially have been a lot of measures that we have put in place, basically restricting where you can smoke, and advertising ban, minimum legal age was raised to 18, removal of sponsorship, graphic health warning, and then of course taxation, a series of taxations, and that has brought our smoking prevalence very impressively from more than 50% in males down to about 20 to 25%. But as Ken mentioned, the worry is over the last several years, things have plateaued off. We somehow cannot get below the 20% in males. Health ministers have given a challenge to Health Promotion Board to bring the overall prevalence to below 10%. That means males and females combined below 10%. My back of envelope calculation is we got to bring the males rates down to 17% by 2020. So we have standardized packaging or plain packaging. We have minimum legal age raised to 21. The question is, will we be able to achieve this target of bringing it down to 17% among the males? I'm trained as an occupational health physician, and I see the measures that have been taken so far in Singapore very similar to measures in reducing workplace health hazards. So we restrict in terms of exposure to health hazards. And essentially all the measures that we have taken so far are similar to harm restrictions. You heard from Ken about harm reduction. Should we actually expand from just health restrictions to include harm reduction or even to harm removal? Should we look at these three general broad strokes and see how can we, in addition to harm restriction, go on to bring the smoking prevalence rate in Singapore much lower? And maybe I'll start off with, I put Health Promotion Board on the spot. Mr. Sim, BK, how do you feel about this new target of bringing the overall prevalence down to less than 10%? And would standardized packaging and MLA of 21 achieve that?
First, I'll say that next year, 2020, I'll be out there looking for a new job.
Tobacco industry will hire you.
It is a good thing that when a minister says to bring it below 10%, he did qualify by saying, yes, it is a stretch target, right? So so when we look at Prof Chia did a back of envelope calculation, bringing male prevalence rate down to 17%. Then for us, if you look at absolute numbers, for example, we are looking at probably getting about 50,000 smokers, right, for them to quit smoking. And that really is a tall order, given the fact that we are stuck at current prevalence rate for quite a while. I think one stats shows that it's probably about for the last decade or so we've been stuck there. So then, how do we bring it down? Question, we have things like tax increases, MLA, standardized packaging, and so on. And I guess the short answer is that each of these measures are not quite enough, right? We still need to look at it as a holistic approach. We have to do a lot of things all together, and even then, we know that it's really tough to move the needle. So we do what we can in pushing. So in this whole scenario, we look at essentially, by the way, I'm speaking from ground level operations, programmatic kind of perspective, right? I will not comment on policies or certain high level governmental strategy. Let me just talk to you, commenting from the perspective of running programs on the ground. So that's what we do. That's what my team and I, we do. We run programs on the ground. So we do a lot of work trying to look into the initiation part of it, how to get young people not to take up the first stick in the first place. And then we do a lot of work helping people who are hooked on cigarettes, helping them to so-called kick the habit, right? And in both of these domains, there are challenges. For example, among youth and the preventing of initiation, a quick survey we did, a survey that was done about 2014, I think, says that for young smokers, about half of them, their fathers are smokers. So that's one. For close to 90% of them, they have one close friend who is a smoker. So you can imagine the whole influence of people near and dear to them, what kind of bearing it has upon them. So of course, they will cite other examples like, oh, it's stress, his life is so boring, and etc. So that's why we take it up. So for us then to tackle initiation, it's not straightforward as in just communicating messages and the harms of smoking and so on. Increasingly over the last 2 years or so, we're also looking at family engagement, how to help the significant others in the lives of young people to prevent their whole initiation. Then in the area of cessation, for example, again on the ground we do as best as you can through various channels, cessation programs, right? Whether it's through remote means or through face-to-face counseling, those are the things that we are doing. But then again, we have, of course, a desired level of take-up of such programs, and that's where we are pushing. And for people who come on board, we also know that, again, the stat says they may need 7-8 times to quit, right? How can we structure our program such that we can help these people every time they fall and they try again, we are there to help them so that they can experience a successful quit journey. So that is our main challenge also. So to sum up again, I'm looking for a new job next year.
Yvette, I know you have done some interesting research based on what's called the tobacco industry papers. Maybe you can explain to us what these papers are, and then in relation to specifically Singapore, those papers talking about Singapore, what are some things that you can learn from there that could help us inform our future measures?
Yeah, so the tobacco industry papers is basically this online collection of about 14 million industry documents. So these documents were previously secret, belonging to the tobacco companies. And they've since been released into the public through lawsuits against the tobacco companies or through whistleblowers that leaked the documents. So from these documents, we've actually been able to learn a great deal about how the tobacco companies operate and about their own, internal scientific research, for example. So it's from these documents that we know that, they had their own research back in the 1950s, which showed that smoking causes lung cancer and a bunch of other diseases, even though, for decades after, they were still going out in the public saying, it doesn't cause lung cancer, So, we learned a great deal about how they operate and their future strategies and so forth. So with these documents, actually quite a few of them are also covering Singapore. 80,000 documents in this resource, of 14 million actually mentioned Singapore. So we did a study quite recently, which looked at how the tobacco companies try to target young people using menthol tobacco products. And we found that, mainly in the 80s, there was this trend in Singapore that the young people were starting to get more health conscious. And this was because the government had been leading anti-tobacco campaigns, which showed that, smoking causes cancer and heart disease and so forth. So the young folks were getting more health conscious. So the tobacco companies, they tried to basically capture these people. They didn't want them to quit. They wanted to keep them in the market. So they started marketing products and very specifically designing brands that they thought would appeal to young people. And when I say young people, I'm referring to teenagers mainly, age 25 and below. Their target group in the documents is 16 to 25, but it's possibly younger than that too. So they had developed these brands using very sophisticated brand imagery, doing very careful research on different groups of young Singaporeans. So, when they were developing the brand imagery, they were using the packaging as a vehicle, and they were also looking at flavors, particularly menthol. So the reason why they tried to target the young people with mentholated brands is because many people seem to think that menthol cigarettes are healthier, or less unhealthy, let's say, than conventional cigarettes. Whereas actually, it's the opposite that is true. Most menthol brands actually contain similar tar nicotine levels as non-mentholated brands. But because they sort of mask the harshness, it gives them the misleading impression that these cigarettes are less unhealthy. So they were using these kind of brands and targeted them at the young people to try and stop them from quitting. And it's still a problem now. I mean, even though this is a historical perspective, I think the issue of menthol is still very relevant in Singapore now because almost half of the tobacco market in Singapore is menthol brands, which is actually massive when you compare it to countries like the US, where I believe the menthol market is about 10 or 20%, correct? Yeah, so actually Singapore only comes second to the Philippines there. Philippines tobacco market comprises over half of menthol. Singapore is second biggest. So yeah, I think and the issue of flavors hasn't really been looked at as a policy issue in Singapore. A menthol ban hasn't been considered here yet. So I think that's going to be an important issue if the goal is to reduce smoking among the young people. And then what this research also shows, based on the documents, is that packaging is important for tobacco companies. So I think Singapore's on the right track, and we've yet to see the impact of plain packaging here in Singapore.
Thanks. I'm just looking at the pigeonhole, and let's see whether I can print this. Okay. Yeah. So I have to answer. Try and send these questions to the panel because there are 32 votes. Most numbers. So maybe I put Derrick on the spot from the Ministry of Health. You have heard e-cigarettes. You heard say menthol cigarettes. What would convince, say, Ministry of Health to ban, say, or restrict menthol cigarettes, flavored cigarettes? Or what would convince Ministry of Health to liberalize e-cigarettes?
I think first we start the standard disclaimer that my opinions are my own and do not necessarily reflect that of the Ministry of Health. So I'm here basically as an epidemiologist, as a public health physician. Right? So happy to discuss some of these issues. I think just to say that Singapore actually adopts an evidence-based approach towards tobacco control. We align our measures, with internationally recommended measures like the FTCC Empower package, and also with WHO best buys. And I think we have, I think the approach basically is a multi-pronged one. Right? So besides what has been mentioned by Khoon, in terms of education to stop initiation, we actually have a package of measures, including excise taxes, including bans on smoking in public places, including bans on tobacco advertising, promotion, and sponsorship. We have also gone beyond some of the recommended measures by instituting MLA 21 and a point of sale display ban in recent years. And then, of course, most recently, we have passed legislation for standardized packaging, among others. So I think no one measure, and I think in addition, of course, there's the role of cessation that's important as one of the prongs in the approach. So I think what we learned over the last 10 years is that actually you need to keep pressing on, because if you don't, the prevalence rate may rebound. Right? But I think since then, over the last, the second half of the last 10 years, I think it seems to come back down, so it looks quite promising. Right? But I think it remains to be seen, the future trends. But what I would say is that I think we will carry on with the multi-pronged approach, right? And see what the prevalence rates go, essentially. With respect to flavors, right? So I think flavors is one measure that has been adopted by some countries that Singapore has not yet adopted. So I think we have been studying it, and we will continue to study it very carefully, looking at the evidence base, looking at implementation sort of approaches, right, and looking at the potential benefits of flavors ban. So we did a consultation some years back, right, and it's still on our radar. Right. In terms of ends, again, I think the approach is evidence one. I think so. I think the data from Korea and Japan are basically ecological in nature, right? So I think we want to split up the analysis. I think Ken didn't quite mention the UK, which is yet another natural experiment, right, where data is going on. So I think the issues are essentially, one is that everybody agrees that nicotine addiction is bad for youth. I think there's no disagreement with that, whether it be from heated tobacco products, whether from e-cigarettes, whether from cigarettes. Right? Everybody agrees that it's bad for youth to get access to these products. No disagreement. Right? So I think the data shows, right, in many longitudinal studies, right, with adjustments. Sure, it's difficult to do because of confounding, and so on. But I think there have been numerous longitudinal studies with many young people that shows that I think it's almost certainly established that there is a gateway effect. Right? I think the only debate basically is how big the gateway effect is on the thing. So that's one big concern, to say that that's one of our big concerns, right? That e-cigarettes or other alternative products act as a gateway. In other words, the youth get their hands on it first, right, and then eventually they get hooked onto nicotine, which is bad in itself, right, and they go on which is bad in itself for the brain. That nicotine has been shown to have effects on the developing brain, right, which the brain develops up to age 25. Okay, and eventually, they go on to smoking cigarettes. So that is one big concern that we have, and coupled, of course, with what's going on in many countries, they have allowed cigarettes to be freely available. So in the UK, for example, experimentation with e-cigarettes among 11 to 18 years old have actually doubled in the last 4 years, between 2014 and 2018. Right, so from about 8% to about 16%. Right, the number smoking regularly, or the proportion smoking regularly, is much smaller, right, but it's still about 2 to 3%, particularly in England. Right, small, but I think the trend is in the wrong direction. So we are watching what's happening in England and the UK very carefully. Right. The other concern that we have, of course, is also dual use. Right. So not every smoker who uses e-cigarettes will stop using cigarettes. In fact, substantial proportion of them may carry on with both. Right? There will be some who will stop, yes, and yeah. So I think the latest study that came out for UK, Hajek et al., is quite interesting. Right? I think the headline result shows that 18% in the e-cigarettes arm stopped smoking, right? And 10% in the NRT arm stop smoking. And this is actually a very selected group. Right? So this is a group of people who have actually decided to quit, have set a quit date, right? And are quitting within the context of smoking cessation service within the NHS, where they're provided with counseling services for the first 1 month of their quit journey. Right? So this is quite intense. So the NRTs and e-cigarettes are add-on, right, to this group of people who are determined to quit. Right? So but when you do deeper into the results, okay, I think there are other signs of concern. Right? One is that of the 18% who quit, 80% of them continue to be hooked on e-cigarettes at the end of 12 months. Right? Only 20% were completely nicotine-free, right? As compared with the NRT group, where the vast majority of those who quit were free of nicotine addiction. Right? The other concern I have is, bearing in mind the medical dictum, first do no harm, is that among those who failed to quit, right, in the e-cigarettes group, 30% of them became dual users. Okay, so you're trading off quitting against dual use. And I think the data from PATH study, right, has shown that between dual users are actually at higher risk of harm in terms of exposure to metabolites compared with even cigarette users, right, in the PATH study recently, the results. Right, so those actually outline our concerns. And then the third thing is basically to say that actually we are looking at RCTs of smoking cessation very closely. There are some that are still in progress besides the one that's just reported by Eijk et al. I think we'll study the evidence as it emerges. Right? But I think the calls to disregard RCT just because there's anecdotal evidence that e-cigarettes help people to quit, I think it's something that we should resist. I think we stand guarded by the evidence, right? And the evidence for treatments, basically, as we all know, right, is RCTs. So I think we are monitoring the reports of RCTs, and I think depending on what the results show, right, we will then act accordingly.
Ken, I mean, as you can see, I mean, you have known Singapore for several years and follow our tobacco control. And you can see Singapore tend to take a cautious approach, especially in relation to, say, harm reduction. Some would argue overly cautious. You care to comment, and what's your view?
As I say, this is the most controversial issue that we've seen in this field for decades, the whole harm reduction issue. And it is ironic because public health has been very supportive of harm reduction in other areas, whether it's clean needles for HIV or protecting kids against sexually transmitted diseases with condoms in schools. We can run down a laundry list of areas where we've been supportive, and we haven't been here. It is a tough issue. Everybody says we don't want kids to use any nicotine product, but we want adults to quit. And the fact is the two are not unrelated. If you produce a product that's attractive to adults, you're going to have a product that's attractive to kids. And you can try to avoid the marketing that targets the kids, and that's been an issue within the U.S. very recently regarding e-cigarettes with Scott Gottlieb, who is the commissioner of the Food and Drug Administration. And by the way, I learned yesterday that he is stepping down. Nobody knows whether he was fired or what happened. This was the one official in the entire Trump administration that I can see who's been sensible and doing useful things that are really constructive and thinking about things in an important way. He and the head of the Center for Tobacco Products at FDA, Mitch Zeller, have referred to the nicotine continuum of risk, and they're trying to get people to understand this. The ignorance about nicotine worldwide is so phenomenal, it's terrifying. Most people in developed countries believe that nicotine is the source of the cancer in cigarettes. Nicotine is the source of the addiction. It is not the source of any of the major diseases that we see from cigarette smoking. I have to say, I have to laugh about one thing you said, Derrick. you were talking about the developing brain. I find it absolutely fascinating. We're hearing so much about this argument about the teenager's developing brain and exposure to nicotine at this point in history, because with the exception of the past year in the United States when Juul, J-U-U-L, has become a real phenomenon among kids, I estimate that nicotine exposure among kids is at an all-time low for the 40 some odd years that we have been measuring it. And it also means for those people that Seng was referring to generously as being 60 or older, those of us who were smokers, of course, we had severe brain damage because we were smoking during this era. This knowledge has been around, yeah. This knowledge has been around for decades and nobody brought it up. It's never been an issue until the e-cigarettes. And I don't understand it. If you look at the use of e-cigarettes, again, until the last year in the US, the use of e-cigarettes is incredibly modest by non-smoking kids. Very few, small proportions of them used it. It was 5 to 7% of never-smoking kids who used an e-cigarette in the last 30 days, and half of them used them no more than 1 or 2 times during those 30 days. I am concerned about Juul, which is a very high-tech product and obviously is very attractive to kids and could be much more addictive because it delivers nicotine much more effectively than a lot of these cigarettes. But my personal sense, and it's no more than that, I mean I study this, but my personal sense is that we have gone overboard in worrying about kids and not paid enough attention to the adults who are the people who are going to die in the near future. And if we could get people to use e-cigarettes or anything else to quit smoking, even if they remain on the e-cigarettes for life, which most of them won't do, we see data in England showing they're getting off of them after they quit smoking, they're better off. They're much better off than if they continue smoking. When we think about the kids, this is horrible. How can you talk about kids this way? It's terrible. But I ask you to think about something. First of all, we don't have any knowledge that the kids who are using e-cigarettes are going on to smoke and becoming smokers. We have some evidence from prospective studies that they are trying cigarettes. But if you look at those data, they have a 3.5 higher risk of trying a cigarette in the next 6 to 18 months. But if you look at the data in some of those studies, that means they tried 1 or 2 cigarettes over a year. That's not becoming a smoker. And the other thing that I would think about, I mentioned how well we're doing in the United States and Great Britain, which is the one country where they're very actively encouraging e-cigarettes for quitting. We're not doing that in the US. But we are seeing decreases in smoking. But if you take a look at what's going on with kids, as I say, first of all, nicotine exposure is very low. The smoking rate is becoming almost invisible among kids in the United States today. It has been dropping precipitously. And here's another question. For a kid who does become addicted to nicotine through an e-cigarette, or even goes on to smoke, is that ultimately going to affect their health very much? How many people in this audience believe that kids who start to smoke today are going to be smoking in 20 or 30 years? I think very few of them are going to be, just because it's becoming so onerous to be a smoker in our society. It is so hard, and so many people have quit. That's kind of where I stand on this. But I don't know. I mean, I don't know how dangerous e-cigarettes are. The one thing I do know is that we exaggerate, and the public grossly exaggerates the danger of nicotine. So I would guess that there are a few people in this room who are addicted to caffeine. Is that a possibility? Caffeine and nicotine have very similar properties in terms of what they do to you physiologically. I've talked to the experts about this. I'm not one, but I've talked to the experts, and some of them think caffeine and nicotine may be fairly similar. Some of them think nicotine may be a little more dangerous, but none of them think that as drugs per se that they're particularly terrible for you unless you're pregnant or a couple of other conditions. But people, again, think nicotine is the problem. It's only a problem because it causes the addiction to the drug that is the greatest creation for killing people that we've ever had.
So Ken, you seem to be suggesting that perhaps e-cigarettes could be targeted at smokers, helping smokers to quit. We want to have a way of handling 20%, of the male smokers. So why not, restrict, in a sense, the availability of e-cigarettes to just smokers? Maybe even like it's a prescription item, a medical device of sort, and not let it be, to the general public, like what you see perhaps in US or even in Malaysia and so forth. So wouldn't that be something that's useful for the smokers, and then at the same time we don't know what's the impact in the general public?
So that's a great observation, and it would be really terrific if Singapore were to try and experiment with that, because you have the ability to do something like that here that a lot of places couldn't do. Derrick mentioned this article in New England Journal. I would strongly encourage you, if you have any interest in this issue whatsoever, to take a look at it. It came out, 2 months ago maybe? A month? And it does show that there's almost a doubling of the rate of quitting. It's a randomized trial, and showed these were people who were not interested in vaping, they were not interested in NRT, and they were randomized to one or the other, and there was a near doubling of the quit rate for the people who vaped. Derrick's absolutely right that 80% of them remained at that point at the end of the study, a year I think it was, remained on e-cigarettes, whereas those who were using NRT were not using it at the end of the period, and also many fewer of them had quit. This is the first really good, interesting, controlled trial I've seen in this area. So lots of experiments here, but first, to do something like what you were describing, Keesing, which I think is a terrific idea, you have to convince the medical profession, and you have to convince smokers that e-cigarettes are a way to try to quit. And maybe that's going to happen. They've been trying to do that in England, and they're not entirely successful there.
So I think this is probably a chance to clarify some misconceptions about Singapore government policy. So I think we are in agreement here to say that, in fact, I think we have stated, although the media hasn't picked it up, right, that actually the door is open, right, for e-cigarettes or any product, right, to be registered under Health Products Act as smoking cessation product, right? So NRT gums, for example, or NRT patches are registered, right, under the Health Products Act, the equivalent of the FDA, Act, as a smoking cessation product, and of course the threshold basically is RCT evidence of efficacy and safety, right? And so that is the case. I'm aware that I think in the FDA, in the UK, in Hong Kong, there's a situation as well, right? But the issue basically is that there have been no, as far as I know, applications for that route. So it's not that the regulators are not holding it open, it's that I think for whatever reason, the companies do not think that this is the business strategy that they want to pursue, right, so to speak.
But while we're still on this topic of e-cigarettes, I saw one of the slide that up there that seems to kind of, and later on in your talk as well, we tend to say e-cigarettes equals vaping. But there seems to be at least, at least two products, kind of heat not burn, and vaping. And they are kind of like entirely different products, isn't it? I mean, anyone on the panel want to kind of differentiate between heat not burn and vaping?
All right, so one thing about these e-cigarettes and these alternative products in general is they're incredibly diverse and they're changing all the time. So when e-cigarettes first came out, they looked more like regular cigarettes, whereas a few years later, then they're starting to look like flash drives and pens and hookah and all this kind of stuff. And the truth is, like, we don't really know exactly what is in each of them because, many of them you use a separate e-liquid, which you then put into the device, and then this e-liquid can be containing a number of things. And generally, it's, as Ken Warner said, it's nicotine, then it has some kind of lipid base, like a propylene glycol or vegetable glycerin solution. And then a number of flavors and additives, which, you know, it could be the sky's the limit, really. So one concern I have is, you know, when you, if for example, you have a best case scenario where all of the smokers start to use e-cigarettes and they quit completely, and then basically you're replacing one kind of use of a product with another, right? But then we don't know the long-term health impacts of those, because even with smoking, for example, many of the diseases that you get from smoking, they won't really set in until you're maybe in your 60s or even older than that. So that's an onset of maybe over 40 years. So with the e-cigarettes, we've yet to see what the long-term impacts will be. So that is a concern if you think about the diversity of these products. Because, for example, some of the flavors, you know, the companies argue that, yes, we've tested the flavors, it's safe to use, but they tested it with ingestion, which is very different to inhaling it into your lungs. And the same goes for the base, which is used to dissolve the nicotine. The base is, as I mentioned, veg glycerin or propylene glycol. Now, this is a lipid, and the lungs aren't really designed to inhale lipids on such a frequent basis. You know, we're used to inhaling air, right? So we don't know what the long-term health impacts will be of that, the possible lung injuries that people may get. And these diseases may be somewhat different to what you get with smoking. They may be similar, we just don't know. So that's one concern I have is, you know, one thing that really sets the case of e-cigarettes apart is that, you know, the evidence base is so fragmented at the moment. You know, some evidence suggests these products are safe, some suggest they're not, and studies can only really apply to particular products. You know, and then further level of complexity is the fact that you have now these heat-not-burn products, like what we mentioned with Eijk. So basically, the heat-not-burn product, it's effectively like a tobacco cigarette, generally a little shorter, and they're inserted into a device. So they're not burnt with a lighter, say. They're put into a device which heats them up, and that way, people can smoke them in a similar way, but it doesn't produce the side stream smoke of cigarettes. But it's still a tobacco product. So it's different to e-cigarettes again, it's just consumed slightly differently.
Yeah, I think that's a very good description of where these things lie, and it is absolutely true. People don't think about it, but the heat-not-burn products are tobacco products. Vaping is not. The e-cigarettes are not tobacco products. I think it's an unfortunate misnomer in a way. They were called e-cigarettes because there is no tobacco in them. The one thing that really, and the other thing I wanted to mention about heat-not-burn that differentiates them from e-cigarettes at this point is that they are all the heat-not-burn products are produced by major multinational tobacco companies. That worries me compared to, let's say, the e-cigarettes, which are much more of a cottage industry in general, not entirely, with Juul having taken off in the U.S. at least. But it bothers me because these are the companies that have the knowledge, the money, the resources of all kinds to market products for lifetime use. And I do worry about some of the heat-not-burn products for that reason. That even if they're relatively low danger, they're not no danger, just as vaping is not no danger. And they have the marketing ability to get people going forever. Something that, again, we're not going to resolve here today. We're not going to resolve anything here today, clearly. But I would ask people to think about, because it's really interesting, the way you were describing the worries, which are legitimate, about vaping and what the health effects might be, is a whole notion of the precautionary principle. Precautionary principle is something we kind of tend to like in the field of public health. We apply it to environmental exposures, and we say, well, we're not going to have such and such a drug in the environment or a chemical in the environment that we know is causing some risk of cancer or something, when there are alternatives for it that hopefully are going to be less risky. The precautionary principle here, I think, can be turned on its head, because the precaution about using something like an e-cigarette that we don't know what its ultimate health consequences are going to be is that we do know the ultimate health consequences of smoking. And we do know that those 7 million people are dying every year, and they're going to continue to die year after year after year. And in some ways, a good precautionary principle might be take chances if you can find something that has a good prospect of reducing that risk significantly, because that risk is so high. But we tend to, you know, precautionary principle in tobacco control is stay away from anything until it's proven that it's not going to be harmful or going to be minimally harmful. And actually, we're never going to know that about e-cigarettes. We know it about cigarettes. We will never know it about e-cigarettes for the simple reason that people are adopting so many different products. They're evolving so rapidly. They're mixing them with tobacco and marijuana and a variety of other things. We're never going to have good epidemiologic data, at least not in the next 30 or 40 years, about the effects of vaping. That gives you a tough policy decision to make. You're having to make policy in a very imperfect and ill-informed world.
Yeah, so related to your point, and I was looking through some of the questions on Pigeonhole. It seems this question seems to stem from the fact that, look, we have good evidence from the West, you know, like say for example from your study that e-cigarettes or vaping could reduce the mortality or the positive benefit of it. Then shouldn't then we kind of like in Singapore, as you mentioned, take that risk, right, based on your study, or based on the UK studies, or you know, let's just take those results and take the risk, because the risk of letting our smokers continue to smoke is so much higher. Wouldn't that be enough? You know, Derrick. No, it's his studies, so we won't ask him. So Derrick, Yvette, DK, you know, shouldn't we just depend on studies that have been done overseas that have demonstrated that, look, there is a benefit, right? Let's make policy decisions on that basis as well.
Yeah, so what you're describing with the precautionary principle versus what the opposite would be the proactionary principle, which is where, yeah, you take a risk based on the potential benefits that you might reap, right? So the best way I would describe this is, you know, in the clinical patient setting, if someone is, say, dying, terminally ill, and there's a drug that might save them, but we have no idea what the side effects are, we don't know if it's going to save them, but you do it because you know that otherwise that person's going to die for sure. So you take that risk, right? And then sometimes it works and sometimes it doesn't. And this is a kind of situation in which is really quite extreme. It's where you know there's going to be a really bad consequence if you don't do anything. But I think with tobacco control, we're not really at that point yet, because there's a lot of things that we haven't done. Even in Singapore, you know what we were talking about earlier with the Framework Convention and the Empower measures, there is not a single country in the world that has really used the Framework Convention to its absolute fullest. You know, even Singapore, where we have quite sophisticated, for example, there's a lot of places that are smoke-free, but there could be more places that are smoke-free. You know, taxes are high, but they could be higher. Or we haven't even looked that much at product regulation, for example, the flavors ban. And we've yet to see the effects of plain packaging, which, as we know, that packaging is still quite an important way for tobacco companies to make their products appealing, right? So I think really, before we start thinking about, you know, taking risks and putting a lot of people potentially at risk with a product that we don't know the health consequences in the long term, we should really look at what works and what we know what works.
Actually, one thing that's really unfortunate, and we know this is clearly true, is not much works. In terms of smoking cessation, we know tobacco control measures that work, but let me point you to a country that I think everybody should think hard about, and that's Australia. Australia charges something on the order of $30 a pack of cigarettes. They were the first to adopt plain packaging. They have all kinds of restrictions on where you can smoke and you know, who can smoke and so on. And their smoking rates, not unlike Singapore, were low, but they've leveled off, and they're not falling. And again, this is anecdotal. That's part of the problem. You're right. We just don't have enough good, solid evidence. Anecdotally, we see smoking dropping rapidly in the United States. We see it dropping rapidly in the UK. dropping at unbelievable levels in Japan. Japan, as you said, it's ecological. But the Japanese case is absolutely fascinating if you're not familiar with this. Obviously, lots of smoking among men in Japan. Their rates of smoking have dropped over the last 3 years by about 12 to 13% in terms of numbers of cigarettes, at the same time that they've been replaced by these alternative HNB, heat not burn products. They don't allow e-cigarettes there. And I don't know whether that's an entirely good thing, but it's really impressive to get smoking down at that rate. That's really striking. Again, I'm not real fond of HNB, but I'm less fond of cigarettes.
Just to say that I think I agree with Yvette that I think the analogy is not the correct one, in the sense that I think there are many things that we can still do under the Empower and under the Best Buys, and then maybe a couple of comments on the Australian and the UK situation. I think we do watch the situations very carefully. So in Australia, our friends in Australia tell us that actually there was a sense of complacency among the government, and spending on educational campaigns dropped after they implemented plain packaging. So I think it was a sense that we have arrived, and that's a precautionary tale for us to say that actually we must push on with sanitation programs, must push on with public education programs, and that was why the decline in smoking prevalence it still continues to decline, right? But it seems to have gone down by a lower rate. In the UK, of course, I think the people who look at the UK data often forget to mention that the UK actually has one of the strongest tobacco control regimens outside of e-cigarettes in the world. Right? So, for example, in just about 10 years ago, 2007 and 08, they made major changes to the tobacco laws to ban smoking in public places. They also instituted a minimum legal age, or they raised it from 16 to 18, right, just about 10 years ago. And you can expect that the effect of this will impact over time. Right? So that, in addition, they also had a very tough sort of excise tax regime. Right, so the government raised excise taxes by 2% every year over the rate of inflation between 2010 and 2017. Right, so that's cumulative. Right, so and of course, they implemented a point of sale display ban in 2012 in the large chains, in 2015 in the small retailers, right, and of course standardized packaging in 2016, 2017. So I think you need to basically try and strip out all these effects of all these measures on tobacco prevalence, right, before you can isolate any effect on of e-cigarette policy. And it's going to be challenging, which is why it's ecological, right? So which is why I think I go back therefore to longitudinal studies on gateway. I go back to RCTs on cessation. Right? Those are where I think you actually strip out as far as you can for the longitudinal studies, and for RCTs, of course, you strip out the compounders. Right? So to isolate the impacts on cessation, to try and get a handle on the impacts on gateway, right? And then we will then look at the data and we will decide upon policy on that basis.
I just want to add on. I think as you can witness, I guess this whole area of e-cigarettes. I guess there's much to be said on both sides of the camp. But one thing that come to mind, like what Derrick is saying, to push ahead with cessation, and then I'm reminded of 2 points here. One is in the one of the earlier charts when we for the US, I think, when the prevalence rate started coming down, I think there was action done by the people. There was one on the non-smokers' rights movement, right? Then there was one on the second-hand smoke, and then Prof Kenneth also mentioned something like the thing is with prevalence rate being stuck there is because as the general public we stop caring about smoking, which is so true as I reflect upon it. My brother-in-law is a smoker. I got 3 male nephews who are smokers, and I've never spoken a single word to them about, hey, you guys are killing yourselves, right? It's like, you're going to smoke, don't smoke in my house, so get out there and smoke, that's it, full stop. So I'm just bringing it out there to all of you that in this, under this area of pushing ahead with cessation, yes, of course, we need to keep a very keen eye on what's happening on all this research on e-cigarettes and using them as cessation tools and so on. But perhaps as a society, as people who can influence others in our lives, as people whose voices collectively may make a difference, what are we doing? it is a very non-sexy subject anymore, smoking, right? It's been around for so long, you know, stop smoking campaign, whatever. It's been around for so long that perhaps we are so used to it. I think the word is inert, you know. We are not immune, but we're inert to it, you know. It doesn't strike anything, no chords within us at all, right? So, but yeah, at the same time, it's out there, right? We still have about 350,000, 380,000 people smoking. 7 million a year worldwide dying. In Singapore alone, we are looking at about 2,000 people dying because of smoking-related disease. So these are people whose lives are lost because of a, you know, preventable, modifiable act, so to speak. So I put it out there to all of us that perhaps in this whole area of pushing ahead with cessation, what else can we do as non-smokers, as, I don't know, friends, as influencers in another person's lives?
Thank you.
Just one quick observation that you made me think about. I assume it's true here. It is certainly the case in the U.S. and elsewhere. We are seeing smoking prevalence increasingly concentrated in low socioeconomic groups, in people who are suffering from mental illness and other substance abuse. And part of the reason that smoking is not an interesting issue is because people don't care about the people who are suffering.
Okay, I've been reminded that N. That just want to draw this to a close. I think one thing that is quite clear is that in terms of harm restriction, there are still several measures perhaps that we have not explored, and we should continue to explore that. In terms of perhaps harm reduction, we can't solve everything this afternoon, but essentially we're open, but it may be quite difficult to find good evidence in terms of whether it will work or will not work. My personal view is that we need to perhaps study in terms of the benefits in specific contexts, in specific countries, and not be taking results, for example, in other countries and apply them directly to another country for policy decisions. And finally, also that, well, let's not forget that it's out there. Actually, harm removal is also another possible option. So with that, let me just end with thanking our panel for this discussion.
Thank you, Prof Warner, Prof Chia, Dr. Heng, Mr. Sim, and Dr. Yvette for the insightful discussion on tobacco control. Thank you to our audience as well for taking the time to join our event. I hope that everyone has enjoyed and gained much from today's panel discussion. Before we wrap up the session, I would like to invite Dean Prof Teo to present a token of appreciation to our moderator and panelists, Prof Seng, Dr. Derrick Heng, Mr. Sim Beng Khoon, and Dr. Yvette van der Eijk.
Wow, newly packaged. Come here.
Lastly, we have a very special token of appreciation to Prof Warner. Ladies and gentlemen, what we see on screen now is the School of Public Health at the University of Michigan, where Prof Warner has been on the school's faculty since 1972. Hard to imagine back in the 70s, and I quote Prof Warner, colleagues will occasionally boom a cigarette from each other, and probably half of the faculty members were smoking in their offices. It's even harder to imagine that Prof Warner himself was a chain smoker during his college days. Oh. In fact, he smoked so much, earning the nickname Nicotine from his classmates. He tried 3 times to quit but failed, until one day in a poker game in 1974, He smoked so much, he felt so terrible, he went back home, threw out all the ashtrays, and made a New Year's resolution out of it, and that time it stuck. Precisely his determination and lifelong campaign in public health threats posed by tobacco has been very inspiring. To many of us in this room and beyond, Prof Warner is indeed the anti-smoking champion and a role model to us. I would like to ask Prof Tio to present Prof Warner with the school's very special token of appreciation. Prof Tio, please. Could we request the panel to come back on stage for a group photo with Prof Warner, please? We have come to the end of today's event. Thank you very much for joining us. Muchas gracias, and please enjoy the rest of the day.